So our respiratory system, what's the functions of our respiratory system? Breathing. Why do we need to breathe?
Or we'll die.
Why?
We have to get oxygen throughout our bodies, so it's right.
And get rid of CO2. So get in oxygen, we exchange oxygen for CO2. What else are the parts of the respiratory system that have other functions? I'm using it right now. Speech, right? Our voice box is found within the vestibular tract. Okay. We'll also talk about acid-base balance. Okay. That's also helped by our respiratory system. We'll talk about that too. Right. And then what's this olfactory sensation?
Smell.
Sense of smell. Where do we have the receptors for that?
Central nerve.
Nose, whereabouts? It's actually on the top of our nose cavity. Okay, it's called the olfactory epithelium on the top of it. Which are chemoreceptors, right? They can sense chemicals in the air. Okay. It also will provide, as we talked about, a first-line barrier. The mucous membranes will also provide a barrier for it. So, in terms of process, here's where we concentrate on is pulmonary ventilation and then external respiration. Okay? Pulmonary ventilation, so you might have heard of ventilator. What is it doing? Kind of breathing, right? So it's inhalation and exhalation. That's the exchange of air, right? So we'll talk about the movement of air in and out of the lungs. External respiration is the exchange of molecules. So oxygen from the alveoli into the blood and CO2 from the blood into the air. That's external respiration. We also have this movement elsewhere, which we'll call internal respiration. Where might that be?
The blood vessels at the tissue, like the cellular
At the
level.
tissue level, right? It's in our kidneys, it's in our lungs too. It's in our liver, it's in our muscles, but it's to the tissues, it's to the cells, right? That's internal. To get from external to internal, we need our blood vessels to take us there, right? Heart and pump. So our cardiovascular system plays a role in that too, right? And then in this chapter, we'll talk about how is oxygen transported, how is CO2 transported. It's some similarities, some different as well. Percentages are different. Okay. So let's talk about the major organs, right? Starting with the nose, nares. We'll have the nasal cavity. So nose is the external structure that we see. What is it mainly made up of? Besides the skin? Hyaline cartilage. How much? Do we have any bone? A little bit where? Right where we have our glasses or something. That's going to be bone. Everything else forming the nose is cartilage. Within that is the nasal cavity, and we'll talk about structures within and functions, right? Paranasal sinuses. How many do we have? What are they? Yeah, 2 of my 9. We talked about this in the bone lab too. Maxillary sinus right here, yeah. Bronchial sinus up here, good. What are the other 2? Sphenoid sinus and the ethmoid. Which one's more anteriorly located? Ethmoid is from here, while the sphenoid we have pain behind the eyes would be sphenoid sinus pain. Okay. We'll talk about again functions. Pharynx is this tube that runs from the back of the nose all the way down where the larynx and esophagus meet. It actually runs down into the top of the esophagus. Then larynx is our voice box, right? If you had an Adam's apple, that's the prominent cartilage. We'll talk about that. It belongs to the larynx. Then air goes from the larynx to the trachea. Then it goes to the 2 main bronchi. And then it branches. We'll talk about them getting to the site of external respiration. What would that site be? Alveoli. Okay, that's within the lungs. And muscles play a role in this process too. Even though part of the system, we always talk about which one. There's actually two muscles. The diaphragm. What other muscles did we talk about in the muscle? Intercostals. We talked about it. One takes place during restful breathing. The other one only during forced breathing. There's others to do forced breathing. So they will also help. Right, so in terms of, we've heard upper respiratory infection versus lower respiratory infection, because we divide the tracts into two parts. Larynx is the middle. So above larynx is upper respiratory. So pharynx, nasal cavity, upper respiratory. Larynx below will be lower respiratory tract infection. So let's talk about the upper respiratory tract infection, upper respiratory tract today. Right? So nose, external portion of our respiratory system, is made up of bone and cartilage. Function-wise, it's to provide an airway, passageway for the air. In terms of the nasal cavity, it warms the air, moistens the air, and filters the air. Right? Turn filter it too. It also, when you notice, if you suffer rhinitis, your blocked, sound does not come out the same way. It resonates. A bigger player in terms of resonating sound is the paranasal sinus rather than the nasal cavity. But yeah, when you have infection, it usually goes to the sinuses, even though sinuses may not be fully infected with some infection. That's where the resonating changes. And then what again is the olfactory receptors? Sense of smell. What kind of receptors are they? Chemoreceptors that sense chemicals in the air. External nares, we do have internal nares, external nostrils. That's what enters into the nasal cavity. Sometimes they just call nares. So nasal cavity in terms of landmarks, right? Let's remind ourselves what's the bottom of the nasal cavity. What is it separating? The oral cavity, right? So it's the boundary. What was the upper part of the oral cavity?
The palatine?
Palates, right? Palate. It's a soft palate, hard palate as well, right? We'll separate our oral cavity from the nasal cavity. We'll talk about hard palate and soft palate in a second. We also have a separation in the middle, dividing our nasal cavity into two parts. What is that separation made of? So that would be the whole cavity is shaped like a triangle. There's a septum, right? Part of its cartilage, just like our nose, but behind is bone. What bones make up the septum? The perpendicular plate and the vomer. What bone does the perpendicular plate belong to? It's the ethmoid bone, right? What forms our hard palate? Palatine bone and palatine process, which the maxilla, the bone process is the structure. Okay, so we do have this. The floor is made up of hard palate and soft palate, right? The nasal cavity is divided by the nasal septum. Anteriorly, it's the cartilage. Posteriorly, it's the bone. It's perpendicular plate and vomer, right? This will divide the nasal cavity into a right and left part. Internal nares, external nares opening the outside, internal nares opening the nasal cavity into the back, which is the pharynx. Okay, more specifically, we'll talk about three parts of the pharynx, nasal pharynx. Does anyone know the three parts of the pharynx? What's next, at least, hopefully? Yeah, next part is the oropharynx, third part is the laryngopharynx. So let's talk a little bit about the nasal cavity. So it has hair as well as other substances, which will filter out substances, right? We will moisten as well as warm the air. So in terms of membrane, in terms of the epithelium there, it's pseudostratified column epithelium, right? So in terms of function of the nasal cavity, it's three: filters the air, warms the air, it heats up the air, especially in winter time, especially when it's cold out, warms up the air as well. Within the nasal cavity, let me draw this picture that way. We saw it, and I said we'll talk about it in the respiratory system, right? So this is looking from anterior view. Nasal cavity looks like a triangle. We talked about the septum, right? The bony parts too. And then on the sides, we have three on either side, scroll-like. It's like little flaps. These are called the nasal conchae, singular conchae. So during inhalation, they're pretty much the same function of the nasal cavity, which are warms the air. But they also have another function. During exhalation, they reclaim the heat, they reclaim some of the moisture. So if our nose is blocked and we're breathing with our mouth, we're losing heat and you feel it, your mouth gets dry because the mouth's not able to reclaim the moisture. Okay, that's an important function of the nasal conchae. It's able to reclaim the heat, and moisture. So we have, you would guess which one's the superior one? The topmost, right? So that would be superior nasal conchae, middle, and then inferior nasal conchae. If somebody had polyps, nasal polyps, it's usually growing from the other conchae. Right? So please note, yes, the function inhalation is the same as the nasal cavity function, but during exhalation it's important to reclaim the heat, reclaim the moisture. Okay, moving to the paranasal sinus. We already knew what the names were. It's frontal, maxillary, ethmoid, and sphenoid. Okay, this is from our book. These two are nice to see anteriorly, frontal and maxillary. It's not very good to see ethmoid and sphenoid, but with that AP view, we need a lateral view. The ethmoids in front, sphenoids at the back. What are these sinuses made of? Where are they found? Where? Yep, air pockets indeed. It's within the bone itself, right? So yes, they make the bone lighter and have a nice solid backbone. They also help to resonate sound. Okay? This is why we suffer with sinusitis. They do not resonate sound as well. They help warm, but again, warm, moisten, with other structures better. Okay? Why do we suffer with, when we suffer with nasal nosebleeds, why is it severe? Why can it be severe? We'll talk about that.
Are you talking about like the pathway? Like if you tilt your head back, the blood can go.
No, but not for treatment of it. But why do we bleed in the first place? Right? Because we have a lot of good blood supply. So if we injure it, something bursts, unfortunately that causes bleeding too. Okay, since you all mentioned it, is it best to ask the person to lean forward or lean backward with their nose pinched?
Forward.
Forward, thank you. Right. Because it's a myth, right? You lean backward, yes, you're not seeing the bleeding, you're not stopping it. Okay? But what are we doing when we lean backwards?
Drinking your own blood.
Swallowing, it's going down gastric in our digestive tract, right? They'll have melena and everything else following afterwards, right? We're not stopping the bleeding, so that was a myth, and anybody, thankfully, EMT is good. And forward, anybody outside tells you bend back, tell them no. Just make sure you bend them forward. Bending back does not reduce the bleeding, just does not show. It doesn't show us that it's bleeding, but it's going to be posteriorly.
So when you put the balloon, is the bleeding going back?
No, balloon basically is,
So
and it's
like
going to
a
squish
Okay.
the blood vessels and try to put it. We can either put balloon or we actually put exact tampons. It's clean the nose. That also does the same thing when they expand and the squeezing. It's not comfortable. Neither one of those treatments is comfortable, but it's to stop the bleeding. Right? You all do that on the field? Please, fellow diabetic. I've done a few. I did a rotation on EMTs. It's almost like somebody's sticking something with your brain. Comes very close to your skull. Doesn't go into your brain, of course. But it feels like it. Okay, so pharynx is the back of the throat. Sometimes they call it the collar. Okay, it's back of the nasal cavity, back of oral cavity, and a little bit lower. It starts at the base of the skull, goes down to about 6'6". So 3 parts: or nasopharynx, oropharynx, posterior to the oral cavity, laryngopharynx, a little above and posterior to the larynx. And then what would be the continuation here? It's actually the esophagus, okay? While air will move anterior into the larynx and then go down, whereas posterior it's our esophagus, okay? So it's the laryngopharynx that decides which way air goes, which way food should go. And this is composed of skeletal muscle. What does that mean? Yeah, we can voluntarily control it. Whereas we'll talk about this when we get to the digestive tract. Once the top part of our esophagus is still skeletal, but then it turns into smooth. What does that mean?
Involuntary.
Involuntary, right? You swallow, you only can feel it and control here. Once after that, you should do not. Sometimes you feel it, you get stretched out, it pokes us, but otherwise it just goes through. We don't feel the movement, we don't control it. So nasopharynx behind, please realize we have the tonsils, right? Adenoids, that's within the nasopharynx. They're called pharyngeal tonsil. That's the correct term to use. Pharyngeal tonsil is at the posterior side of the nasopharynx. What's this eustachian tube? Sorry, I don't know where is that. From your which part right here? Middle ear. What's the function of the eustachian tube? Equalize pressure. The function is not to drain fluid, right? There shouldn't be any fluid in there. If it fluid is there, it's actually gotten from, it's a reflux, right? From the back of the throat into the nasopharynx. The eustachian tube is to equalize pressure in the middle. Okay. Oropharynx behind, we're going to come across two in this region. Lingual tonsil, technically it's actually within the oral cavity rather than the oropharynx, but it's right at the boundaries. So here, palatine tonsils, what are those? They are what tonsils, when we talk about tonsillitis, we're really talking about the palatine tonsils running up right at the back of the throat behind the soft palate. Lingual tonsil is at the base of our tongue. Okay? This is lined with stratified squamous, whereas nasopharynx was pseudostratified columnar. Why should this be lined with stratified squamous? Yeah, what is going to cause the abrasion? The food, because oral cavity goes into the oropharynx as well. Yes, air also passes through, but it's the food that will cause that abrasion, right? It's stratified squamous of the tongue. for food and air. Right? And we'll look at this more in lab. I'll show a nice sagittal view of the face. While laryngopharynx is also passes food and air, they'll push the air into the larynx, they'll push the fluid into the esophagus, or guide the food. It doesn't really push. It's the fact that the larynx is closed, it moves down into the esophagus. We have to close off the opening, right? Which is done by, which prevents food from entering into the larynx. Epiglottis, so it shuts off the opening to the larynx called the glottis. That's why the name comes from. What's epi mean? Above, right? So top of the glottis, the opening. So it closes off the larynx, the opening of the larynx, and food does not go in there, it goes into the esophagus instead. This is also lined by stratum and squamous because we also have food and air passageways. Let's talk about, larynx and the stuff, okay? Larynx is also called the voice box, okay, because we have vocal cords in there. It opens from the laryngopharynx and then continues as trachea, okay? So, it says provides patent airway. What does that mean? Open, right? What structure within the larynx assists with that? Rings are further down. Cartilage, right? So it's the cartilage in the larynx that makes sure it's open. We talk about the trachea, so there too it's going to be cartilage. There's no bone in the ears. Yes, technically, on top of the larynx there is a bone, but bone is sitting right on top of the larynx. Hyoid bone, right? But it's the rest of it which really form the crux of our larynx. It's cartilage. The main one, the Adam's apple one, that's the thyroid cartilage, and the one below it is the. Brandon, can you repeat what you said earlier? Cricoid cartilage, right? And then if you talk about tracheostomy, where that goes through, it's actually just between these two. It's actually going to be called cricothyroid membrane. Okay? So it provides a patent airway. It makes sure, the larynx makes sure that the food does not go in here, air, right? And then has the vocal cords. So in terms of cartilage, there are actually different ones. There is the thyroid cartilage, singular, just one. Cricoid cartilage, singular, just the one. We have a pair of arytenoid cartilage. These three we'll look in the lab. The other one, just realize there's two more sets of it, but they're so small and they really don't have a proper function. We don't talk that much about it. Okay? And then we also have the epiglottis, right? That's the only one out of all these cartilages. That's what kind of cartilage is epiglottis made of?
Elastic.
Elastic, while the others are made of hyaline, right? Cricothyroidotomy is when we go between the thyroid cartilage, so the main pronounced one, as I mentioned, it can be prominent, we call it the Adam's apple. Just below that is the cricoid cartilage. Okay, between those two is called cricothyroid membrane. That's where we will have to do external intubation. And below that, we start with the trachea. It's tracheal cartilage rings that we see here in last thing I want to talk about is vocal folds. We actually have two sets of folds. Okay, we have one on top, which does not move, does not produce sound. It's the one at the bottom that moves, right? So by the movement, it passes sound, air differently, and produces sound. Right? So we'll look at that too. Vestibular folds on top, you might hear of that, and vocal folds are true vocal cords at the bottom. Glottis basically is the opening in the larynx. Okay? vibrate produces sound. Any questions? We'll stop there. We'll talk in lower.